Hi Facebook. Hi guys, how are you doing? Right. So my name is Dr. Muhammad Shah. I'm with Live Online team, and today we are going to talk about one of my favorite topic, how to prepare for the USMLE exams. So before we start, I would like to know, where are you guys from? Just type in your location so I know where you guys logging in from. I know some of you are from different part of the world. Somewhere it's middle of the night, somewhere it's early morning. Awesome. All right, so let's dive into the topic. Basically what will happen, I will cover some of my points, and after that I will take questions. So I know you guys have questions, and we will talk about your questions. And before we do, let's talk about some of the important things. When you are preparing for the USMLE exam, one thing you need to understand: the USMLE exam is a very conceptual exam. It's not a memorizational exam. You have to understand the concepts, core concepts for each subject. Okay. And before you even start, you need to know a couple of things. What is the time frame? Average time frame the student have about, for the step 1, if I talk about, like 5 months to 7 months, sometimes a little less, but it's the average time frame. And before you start for the step 1, in fact, you need to know where you are. And you have to, I would suggest, take the diagnostic test, and the diagnostic test will tell you where you are as of today. Not only that, but when you take the diagnostic test and you will be progressing throughout the preparation, you can gauge your progress, how fast you are moving forward, how fast you are improving. So yes, the diagnostic test is the initial test, and then after you can measure your progress. Kaplan have a free diagnostic test. I would suggest please take the free diagnostic test and meet our medical advisors to discuss the diagnostic test and what time frame you should have for your preparation. All right, so a steady strategy is important. You have to have a steady strategy. What happens if you have a good steady strategy? You will study better, you will learn better, and you will be able to apply the content better. So I would encourage, create some type of strategy that help you to achieve the highest possible score. Now, a score is the only thing. The program director looking for the highest score. You guys wanted to get the highest score. Why? Why this score is so important? The score is important because the score gives you more interview calls. Okay, score can get you into the residency program. So the higher the score is, better the chances is to get into the residency program. Awesome. Okay. So let's talk about the strategy. I was talking about the strategy. Let's talk about the strategy. Some of the things that you need to really carefully work on. Focus on the topic that you're studying. For example, you're studying physiology. When you are studying physiology, I really need you to be very focused on the topic that you're studying. Distraction free, guys. You don't want to be distracted while you are studying. The inactive mode study is the best of good time. So please, when you are studying something, be an active learner. I will talk about the active learning strategy, but be an active learner. Also distraction free. You don't want to be thinking about the car wash, laundry, and this and that. When you are in the library, or when you're focused to the topic, you have to be 100% present on that topic. The second, keep learning new things. I mean to say, when you are taking the diagnostic test and you got, for example, 50% diagnostic test score, you have to figure out how you're gonna get from 50% to the 70%. So learn new things. If you know something about for example, biochemistry, then try to improve it. Okay, your biochemistry score is 60%, for example. How you gonna improve? Is that the vitamin is the portion that is deficient? Is the metabolism is the deficient? What is that is lacking between 60% to 70%? You need to focus on that. Fill the gaps, I mean to say. And once you start learning, there is one saying that use it or lose it, right? So if you learn, I would suggest try to use that information in a QBank format. And find out what are the multiple different ways to learn. One is listen to the professor, and second, watch the videos and understand what the professor is saying. Third, read from the Kaplan book and understand what the book is saying to you. When you do that, try to write down some notes. When you write, you are learning. One of my favorite learning style is teaching. Okay, when you know, for example, sickle cell anemia, if you know about sickle cell anemia, I want you to talk about it, say things into your own word, verbalize it, so that way the information will get into the subconscious and in your long-term memory. Right? So translate topic into your own word after reading from the Kaplan books or attending from the class. Okay, again, utilize the previous learning to promote new learning. So certain things, if you know about the sickle cell anemia, what is missing there, guys, is that the genetic portion is missing, biochemistry is missing, pharmacology is missing. So if you find out this is the gap, fill the gap, and then your score start going up. Okay, those are some of the strategies that you should focus on. Also, learning style is a very important thing. You need to know what is your learning style. Many students, I talk to thousands and thousands of students, but I tell you that the many students have different styles of learning, and when they figured out what is the best way to learn, their score jump up. So many people say, I learn it when I hear from the student. So attend class. If you are the person who listen and understand it better, then attend classes. Some people say, when I read, information imprint in my mind. So I mean to say pages, Kaplan books pages. If you are a visual learner, then I would suggest look at the notes, write your notes, draw charts, graphs. So I mean to say, if you are a visual learner, have that strategy. Some people say, when I write down that information, I learn better. So please, if then you create your flashcard notes that help you to pull out that information at the last few days before your exam. So review your notes, write your notes. The last thing that I normally hear from students, that when I explain things, that information get into the long-term memory. So if you are that type of person, try to explain, try to talk about the topic more often. A study plan is very important. You have to have a study plan and have a smart study plan. When I'm saying smart study plan, I'm saying SMART. If you have a pen and paper, you should write it down. Smart, when I say smart, I mean to say you need to have a spaced repetitions. You learn something today, let the brain to digest that information, and after some time you need to go back and repeat that information. And same time you need to evaluate, measure your results. For example, you finish physiology and now you wanted to say, okay, I wanted to measure my progress. So you try to do questions on a physiology. Questions are going to let you know that where you are missing, where is the exact gap is, right? Then the A is active learner. Be an active listener, active reader, learn actively. Be present what you're doing and mentally what you're learning, digest that information and process that information. And R is your realistic question practice. Means you need to start using Q-bank question once you are done learning content. And have a T is a target prep. You have to have a target, your daily target, weekly target, monthly target, and from today to the exam target. You have to have a target. Also, in the Kaplan world, what we say, for example, this is your start. Today you are starting. This is the exam date. From start, you are investing your time in a learning. Don't focus too much on a question in the very beginning. Try to learn content, read everything, understand, build a strong foundation. And as soon you are start moving toward your exam, you are cutting down your time of content reading and investing more time in questions, more and more questions. As you get to the nearby exam, you need to do more and more questions. So that's how your study plan should be. If you need help, please reach out to the Kaplan Medical Advising team and we will be very happy to assist you. Let's talk about some of the preparation mistake that a student do. One, I already mentioned, passive studying is bad. Okay, if you are in the library, if you have books open, you have to be actively studying. Second, insufficient questions. Many students input the information and they really invest so much time into learning, and they don't do practice question. That's bad. You need to really learn and input and output information by using the question banks. The third is memorization and understanding. You need to memorize, but first you have to understand the core concept about the topics, and then you have to focus on memorization. Memorization should not be your priority. Memorization comes itself, but once you understand the topic, no matter how the board is going to ask you question, you're going to find the right answer if you understand the topic very well. All right, the fourth is your test day strategy. Have a realistic timeline. Don't stretch it too long, or don't have your unrealistic timeline as well. So create a realistic timeline. And the last, fifth, is your when you are reading something, try not to misinterpret or misread, especially the questions that you're doing in the question bank. So when you read the questions, make sure reading and understanding and processing the question in the right way. So try not to misinterpret the question. I say my students that don't select. If you are looking at the option A, B, C, D, don't select. Try to eliminate. Try to eliminate B, why it's wrong. Try to eliminate C, why it's wrong. So have a reason of eliminations before you select. That's how you're not going to make a mistake in your actual exam day. Your score will be very high if you do that. All right. You guys are the best of the best the society have. You definitely can beat this exam and achieve the highest possible score. Many of you are already graduate. You have gone through with the medical school, and many of you just get to the medical school, right? If you can get into the medical school, this is just one of the exam. So definitely, I have no doubt you can do it, and you can do it very well. But you have to have a realistic timeline, as I was saying. If you try to learn so much so fast, definitely you can, but the information will plateau and you will start forgetting so much faster. Go slow, create a big picture framework, and try to work around it. Repeat, spaced repetitions. You learn, give it time, practice, go back, learn again. Repeat your weak areas more often, but make sure you repeat all areas. You just don't focus on a weak area. Try to repeat everything, but more focus on your weak areas. Find out what is your weak area, and then you work on that. If you do that, then the proper planning will minimize your stress and maximize your score right before your exam. All right, so one thing I say that don't be just reading. When you are in the library, ask questions. I mean to say, ask question. Why the book is saying what book is saying? If book is saying something, is there any reason behind it? What is the reason? Why question should be always there for step 1, step 2, step 3. I mean to say, you need to find out what is the reason, what the book is saying, and have a strong understanding. Especially with the step 1, you need to know how to integrate and process the information. If you are reading about the renal physiology, try to integrate it with the other subject, maybe pathology, or even with the physiology itself, with the different organ system. How does the kidneys are involved in the endocrine process? How does the kidneys are involved in the cardiovascular system? So you have to integrate, and integration gonna get you a long way. Your score will be off the roof, means if you can integrate in a step 1. So work on integration. I would suggest if you are attending our classes, please focus on professor, because our professor really pull everything and compress everything. Okay, you don't have to do the research, they do it for you. They get all the information in one place and present it in front of you, and they will present in a way that you can understand it better by illustrations, animations, visual concepts. So yeah, so focus on our professors and what they are saying and how they are presenting the information to you. This is a long way. It's about 1.5 to 2 years process. So a lot to do from day 1 until you walk into the residency ward. There is a lot to learn, right? My suggestion, please have a day off. Throughout your period, you have to have a time off for yourself. for your friends, family, so you need to give your time off to yourself. Students always give me the list of the different resources that can I use this, can I use that. I say that trust on Kaplan's resources. Kaplan provide you the best resources and earn the mastery on the content. If you go on a USMLE website, they says the word mastery on the content. They are testing your mastery on the content, and Kaplan is providing you everything that you can earn the mastery on the content. Don't overwhelm yourself with the outside so many resources. So first find out what are the resources you're going to use. Remember I said you have to repeat, because if you have so many resources available, yeah, you have to repeat it all again and again. Limit your resources so you can easily go back and repeat. That's how you're not going to dilute your information. You will be good to go on the exam day because you will repeat everything. If I talk about the questions, QBank question or exam vignettes or question vignettes, step 1 or step 2 or even step 2, these days the vignettes are getting longer and longer, so much information in the question vignettes, right? So I would suggest always practice your questions on the QBank with the timed mode. Don't build the habit to do the question on untimed mode, so practice on the time mode. With that, your speed will improve and you will be able to find the right answer. Your brain can pull out the information within that few seconds of time. It takes time, but with the practice you will be able to do that. Also, if I say there are 2 bad habits that a student build during the preparation, one is repeating the question vignette. Try not to build that habit. Try to read the question vignette once and look for the right answer and find the right answer. Second, sometimes students select A, then they move to the B to C. Don't do that if it's not necessary. So before you select, find the reason why you are selecting. That's why I was saying eliminate before you select. When you do questions, you are trying to do questions for a reason. You're trying to find out what is the reason behind I am making a mistake. So find out what is the pattern of your mistakes. Is it that you are missing the initial diagnosis? Are you not paying attention what exactly the question is? Are you missing the risk factor? What is the thing that you're missing every single time that you're giving a wrong answer? So find the pattern and work on it. All right, let's talk about the question amount. I always get the question from a student that how many questions should I be doing? Different timing during the preparation, different amount of the question you should be doing. One random block is throughout your period of preparation. Second, for example, you are in the physiology, you finish the physiology. Now try to do 2 to 3 block on the question of physiology to see that how much you know about it. Okay, when you are nearby the exam, about 6-7 weeks before your exam, I would say 7 blocks per week is a good way of doing it. So pick a day, you do 7 block on that day. Then you review the explanations of those questions. Sorry. In the final, I would say about 200 questions, 200 to 250 questions every day before your 15 days when you are within exam. So before 2 weeks, you start doing about 200 questions a day. That's the way you will be ready on the day of the exam. 1 block every day throughout your preparation. When you finish your subject, you do 2 blocks on that subject to know how much you know. Then 7 blocks every week when you are within about month and a half away from the exam, and about 200 questions when you are within final 2 weeks of your exam. I know it's challenging. I know it's difficult, and you guys are the doctors. You are born to defeat the challenge. You are different. Okay, so manage the attitude of confidence. You have to be positive, because this is just one of the exams that many exams came in your life, and now this is just one of the exams that you are going to do. So have a confidence, work hard, and have faith in yourself that you will achieve the targeted score that you are aiming for. We call the Kaplan Medical Honors Society. So if you receive the score about 250, please contact us and we will talk about the Kaplan Medical Honors Society. All right, so I know it's a lengthy topic, and we have limited time. I wish we can cover more, but I really wanted to answer your questions as well. So let's see what questions you might have, and then we can go from there. But please do not hesitate to contact the Kaplan Medical team, because we are here to assist you, to help you, to assist you to so you can achieve your dream come true, right? So we are here to help you. Use us as your resource. All right, so let me see, lots of questions here. I think I covered that part. Well, there is one question about the expenses, so please talk to our medical advising team. They will assist you what course would be best fit for you, because we have a different program and every student is different. So reach out to us and we will talk about the best course that fit for you. Okay, the program directors, about the program directors, I say they look couple of things. They look at the highest score. They look at the letter of recommendations, and they look at your year of graduation, and they also look at many other things, but how your interview went, is this the good program for you, if your personal statement, how the personal statement is written. So we always have a different free event, so please join our free events. So every time we have a different free event that cover all these topics that you are asking. Okay. Okay. About your personal statement, I would say it's just an opportunity for you to write a letter to the program director that why they should hire you or call you even for interview. So don't really get into the too much detail into the about your what's your scores and where you graduate from. Everything is already in the ROS. So about the personal statement, I would say just a simple letter to tell program director a little bit about you. About your graduation percentage mark, Dr. Rana, about your graduation marks, that really should not matter for many IMGs. For the IMGs, the program director are more interested about your USMLE scores. Okay, what is the best QBank? Okay, that's one of the good questions. Any quiz means I would suggest that try to use Kaplan QBank. We recently just reorganized everything in that. We have uploaded new questions in our QBank. It's amazing. For decades and decades, students been using Kaplan QBank. I use it myself many times. So you go back and look at our new QBank. And there are new questions, new format, new ways to gauge your progress. Right, so for the residency, getting into the residency, there are different events we do. So please stay tuned, and we look at our website how to access our free events. How many months you should be studying? Very good question. For step 1, as I said, about 5 to 7 months, depending on your strength and understanding about the concepts. Same thing about the step 2. What you are learning in a step 1, basically it's a basic foundation. In a step 1 main question, the exam is asking you, do you understand the concept? What is the mechanism behind this topic? In a step 2, the main question is, can you diagnose? Can you treat? Right? So what you're learning in a step 1 will help you to achieve higher score and get it done faster, your step 2. So if you're talking about this step 2, step 1 plays major role. So same thing with the step 3. When you're taking step 3, what you learn in step 2 will assist you. So try to earn the mastery, and it will help you to perform well on your future exams. All right. About QBank, let's what I suggest my student, don't start the QBank right from the day 1, because the QBank is designed to understand your strengths. So first read a little bit, understand the material, learn the material, and then you start doing some question. First build a small foundational knowledge, okay, and then you can start working on the QBank. About the surgery residency, yeah, or fellowship, yeah. So Dr. Asad, I would say you have to really work hard to get the highest score possible for getting into the surgery residency, because surgery residency is a very competitive field in the United States, and I would encourage you to achieve the highest score possible. What is the highest score possible? Okay, about something nearby 250. If you can cross the 250, that's a great score. Okay, letter of recommendation. When you, it's in the United States, it's not an easy task to get observership and get the letter of recommendation. I would say when you are done with this step 1, when you are done with this step 2, and you are ECFMG certified, apply like a job. You're applying for a job basically. And when you are ECFMG certified, it's easy to get into the clinical observership or clinical experience, and then you can ask for a letter of recommendation. Okay, so Dr. Sanjana, I think I gave you the answer on that. So if you have any more questions about the letter of recommendation, about the clinical experience, I think you need to do research, but I think you can reach out our Kaplan Medical Advising team and we will talk more about it. Okay, so Dr. Rahmatullah, so yes, so I would suggest contact the consulate and they can assist you on that. I think it's a question to the consulate how they're going to handle that, or the attestation programs that they have, or find out by contacting to the ECFMG. All right. So what are the most, Dr. Nida asked, what are the most mistakes the students have been so far making to get the lowest score? Improper timeline, getting exam done faster, sooner than prediction. So don't rush. If your gut feeling is telling you you're not ready, don't take the exam, because once you take the exam and you pass it, there is no turning back to improve your score. You're done. So you utilize your resources to find out, are you ready for the exam and getting that score that you are targeting for. So first figure out that, then you appear into the exam. So never walk into the exam room by having gut feeling that you might just pass. That's very bad. Right. Yes, Dr. Rabia, 8 months should be enough time frame. How many hours should I study every day? That's one of the most commonly asked question, I would say. About 8 hours to 10 hours is a very good time frame every day, and have a 1 day off. How do you know I'm ready for the exam? Look at your QBank score when you're passing nearby 75%. I would encourage students sometime, if you can, please take a MBMEs. Kaplan have different diagnostic tests, so utilize that, and also reach out to the medical advisor in the Kaplan and they can talk to you more about it for the exam readiness. Awesome. Okay, Corey, it's a very good question. You need to contact first of all, to the Kaplan Medical Advising team. We will talk about, so for now you're getting into the medical school and thinking about the USMLE. That's good, and that's MCAT and ahead, and then after the USMLE you are way ahead. All right, that's good, but please reach out to us so we can guide you from now on, so how you can plan upcoming few years. All right, guys, I wish I would have more time. Okay, but it's so nice to have you all and so many wonderful questions. Time is almost done, so yeah, so good luck, and please reach out to us if you have any question. Thank you so much for having me today.